I'm Sakshi Dua, and I grew up in India. That's where I went to med school, and then came to the US 18 years ago for my residency and fellowship training, and decided to stay and never go back. I represent a community of doctors who work very hard, that work in very intense environments, and need the feel for support from their surroundings because the surroundings are extremely intense and emotionally challenging. What really opened my eyes was when one of our colleagues gave us a talk about burnout and fatigue, and I really got chills the moment I saw her first slide on the PowerPoint because I felt, oh my goodness, this is how I've been feeling for the past few days. And the exact definition of burnout that she gave was number one, depersonalization, number two, emotional exhaustion, and number three, decreased sense of self-worth. And when I looked at that, I was like, I know so many people that I'm surrounded by who feel exactly the same way, and we don't seem to have any kind of an outlet or support system in place to express these emotions safely or do anything about it. So my project is called Doctors for Doctors. It came about when I was doing the self-expression and leadership program with Landmark. The reason I picked it because it was very personal to me, having felt the what burnout and fatigue feels like. I didn't want to be one of those physicians who have compassion fatigue and don't really feel much. Definitely a feeler, so I wanted to keep that intact. What Doctors for Doctors is a support group for my colleagues, which are my community, to basically get the people together in a safe environment in which to express emotions under the care of a qualified health professional, such as a psychotherapist or a mental health counselor, so that we are able to better have coping mechanisms and techniques to deal with stress and burnout and fatigue. So what it entails is getting together for monthly sessions under the auspices of either a mental health counselor or a life coach or a wellness expert or a psychotherapist. So it doesn't really have to be just mental health. It is also nutritional, it's also sleep related, it's also exercise. So we have like multiple facets in which we deal with on a monthly basis. It's an hour-long get together. I usually bake muffins and bring because I always feel food fixes everything, and that's how we actually do it. And I've had 3 sessions so far, in which one session we had a group therapist. This woman actually specializes in families, so we are a family. So this person came and basically sat around with us for an hour, and we all expressed what was our biggest fear in our profession, what was our biggest strength and weakness, what we thought could get better, and what we deal with on day-to-day basis. I think with any kind of project like this, of course, I have to figure out a way to compensate the people who are spending their hour helping up my group and my community. And so financially speaking, it would be important for me to figure out how I can compensate these folks, like the wellness expert who spends an hour with us. So far, I've been doing it out of my pocket, but obviously, fundraising would be important for something like this. So money definitely is one. And the second thing would be other interested people who are in the wellness industry to come and spend their 1 hour with us on a monthly basis on a more consistent level. Right now, I've had different people come for every session, but it would be nice to get one person dedicated for continuity. Yes, right now it's just limited to the institution where I work in because it is my immediate group that I'm dealing with. But the whole idea is to involve other sites as well because this is a universal issue. This is not something that's just limited to just one medical practice. My definition of peace comes from contentment and lack of conflict. And so when you're able to wake up every morning and look at yourself in the mirror and feel that you're at your best, most positive self, that is peaceful to me. Because in the profession that we're in, the work that we do is very fraught with conflict. There's lots of self-doubt. There's that tyranny of perfection. There's a lot of like second guessing. And in medicine, there's nothing 100% right or wrong. It's never black and white. There's always shades of gray. And so a lot of times, it's personal influences that come into professional decision making. So for me, peace is that contentment and lack of self-doubt. For our youth, I would say it's a very rewarding profession to get into medicine and be a doctor. You really have a great sense of purpose in life. You never struggle for that. Your meaning on this planet is really well etched when you are a physician. But at the same time, it does involve a lot of personal sacrifices and it is emotionally charged. So I would say for the youth who are interested in getting into medicine as a profession, surround yourself with loved ones who can care and support you in your time of need because you're spending your entire waking hours taking care of others. Please remember that physicians are also humans. We're not superhuman. We have emotions. We deal with ups and downs. And so to be nice to your doctor would be very good.